And joining me now is Dr. Gebhard von Cossel. He's Head of Corporate Strategy Medicine at Sana Hospital Group. Thank you very much for being with us today, Dr. von Cossel. Thank you for taking the time. So the Sana Hospital Group specializes in acute medicine. I take it that the last month with the COVID pandemic must have been very challenging. What would you say was your biggest learning?
My biggest learning was networking. Of course, none of us knew what to do in a pandemic like this. So we had to gather all the experience we got from our hospitals and to combine the experience and the capacity of all our physicians in order to make the best strategy for our patients, but also for our employees, and of course to be an advisor for the government in terms of managing the crisis.
That's very interesting. So you were actually advising the German government. What role did you have there?
There was an advisory panel in the German Health Ministry, and of course we had the data from our patients, and we had the real life experience, and which contributed to form a strategy, since the Ministry of Health didn't know exactly what to do. None of us knew, but the combined knowledge of the players in the healthcare business and in the hospitals, they were pretty successful, I would say, in terms of forming a strategy.
So when you say that the access to data was that crucial, would you say that we would be prepared for a new wave or another pandemic better the next time?
Yes, definitely. We know the crucial points, for example, having enough masks for our patients and for our staff. So we know much more about supply chains, and we know more about therapy for our patients. So we can stock up in our supplies in order to manage a future pandemic. And I'm pretty sure there will be a pandemic. If it's not a corona pandemic, it will be something else.
So we have to be prepared. Okay, so Sana Hospital Group is very broadly specialized. You offer treatments in many fields. Can you give us a bit of an overview, or what would be most important to know for our international patients?
So our main point is the big variety of specialties. So we have acute care hospitals, but we have also heart centers and orthopedic centers, but we also have rehabilitation clinics, so we can serve and treat the patients in all stages of his disease. So this makes us interesting for international patients, because we do not only have one specialty, but we have a whole compound, a whole broad array of specialties.
Okay. I take it that sort of early rehabilitation is a bit of a German specialty. Is that something of a unique selling point that you have?
I think so, because, for example, long COVID syndrome. The people that survived COVID-19, but they are not healthy. They are sick. They have all kinds of problems, and they need to be treated, and they need some more support, not only by physicians but also by physiotherapists, ergotherapists and stuff, and people like that. So this is, it's kind of unique selling point. That's right, yeah.
Well, thank you very much, Dr. Gebhard von Cossel. Dr. Gebhard von Cossel from the Sana Hospital Group. Thank you.